Welcome to the program, everybody. You probably recognize our first guest. She has been with us in the past on this program on Community Health Matters. We want to welcome Dr. Michelle Fiscus back to the program. She is the co-founder of the Cool Springs Pediatrics, also the former Tennessee chapter of the American Academy of Pediatrics, the former president, I should say. We're so glad to see you back on the program.
Thanks, I'm real happy to be here.
You know, in the past, you've talked about kids and everything pediatrics related. But today you're talking about a personal journey because you yourself have been a patient, and we want to hear about that experience. If you don't mind, Dr. Fiscus, telling everybody what you've been through.
Right. Well, I'm happy to share it. I'm happy to be healthy to be here. About a year ago, I had some testing done that showed that I was at very high risk for developing breast cancer. And given that information and talking to my physicians, I had a choice to make. Do I wait and watch and continue to have biopsies and abnormal tests that need to be chased down, or do I take the opportunity to do something proactive for my health and do something about it? And fortunately, with breast cancer, you have the opportunity to do that. So about 9 months ago, I elected to have bilateral mastectomies, which means having my breast surgically removed. And at the same time, around the same time, also had a hysterectomy to remove my ovaries and uterus because of the association between breast cancer and ovarian cancer. And I've spent the last 9 months just kind of trying to move beyond that.
Wow. You had mentioned that you were aware of the fact that you're at risk. Do you have a family history, or what? How did you know that you were at elevated risk?
I have a terrible family history. Actually, every woman for 3 generations now, except for my sister, has had breast cancer on my mother's side, every one of them. Wow. And most of those women, all but my mother, were in their 40s when they had their breast cancer diagnosis. So I have a very dear friend of mine who's a breast cancer surgeon who's been following me. She actually did my mother's breast cancer surgery, and she's been following me and encouraged me to get an MRI of my breasts, even though I have had mammograms since I was about 35 and they've never shown anything. She wanted me to have a baseline MRI, and that MRI ended up being abnormal. And then I had biopsies, which were also abnormal, but nothing showed cancer. It just showed that I had some changes in the cells that were consistent with maybe heading in that direction.
And you actually were diagnosed then with breast cancer after making the decision. It kind of explained when your diagnosis came.
I was. So I had the mastectomy in April, and 2 weeks later when I went in for my follow-up, my surgeon handed me my pathology report that showed that I had a 2.5 centimeter ductal carcinoma already in my breast. And that's about the size of a golf ball, maybe just a little smaller than a golf ball, which had defied 12 years of mammograms and ultrasounds and MRIs and biopsies. So I was extremely fortunate that it was a very large mass, but hadn't moved beyond the breast. It was still localized in the duct. So it hadn't gone into my lymph nodes. I didn't have to do radiation or chemotherapy as a result of that because it was caught early, even for a large mass. And so that's the way to get a breast cancer diagnosis, is when it's already gone. So I didn't have the, oh my gosh, I've been diagnosed with breast cancer part to go through because of that, which was fortunate for me.
Because you took those steps, Dr. Fiscus, what will your experience be like going forward in terms of scans and check-ins with your doctor now?
Right, so I went through several surgeries for reconstruction and have had reconstruction now, which is almost finished except for some minor cosmetic things. And so I have implants now. And so I don't have to have mammograms anymore because there's nothing to mammogram.
Sure.
I have manual exams with my surgeon, and that happens right now every 3 months. And then I believe they move me to every 6 months, and then yearly after a period of time, and then I'll be, continue to be followed. But really what they need to do is feel for any kind of masses that could occur, up under my arms where my lymph nodes are, or in my chest. And then if we need to evaluate anything further, that would probably be done through MRI rather than, any other X-ray type of scan. So
your family has the history. You knew that. You're a very young woman. And I look at that and think to myself, you're also a doctor, so you're going to probably be even more conscientious of seeking help or getting your mammograms. All that to say, though, what would you tell women who are watching this today who know that maybe they have somewhere in their family, you know, some breast cancer? What would be your, advice or your, encouragement to them?
Well, the recommendation is to get mammogram at 45 if you don't have a family history. But if you have a mother, a sister, a grandmother, an aunt who has breast cancer, especially if they're under the age of 50, it's really important that you be very diligent about your breast health. And so that may mean consulting with a breast surgeon, even if you don't have cancer, even if you're not going to have surgery, consulting with them because they do manual exams, they can recommend different ways to look for cancer, like genetic testing perhaps.
Oh, sure.
Or MRI like I had, and follow you along and help you make those decisions proactively, and hopefully if you're going to go down that road of cancer to catch that as early as possible to minimize the treatment that you have to go through.
Yeah, just having that diagnosis, I think for any woman or even men, when you hear cancer, breast cancer in this case, it's not an easy thing to accept, but given the fact that you have a medical background and that you're a practicing, pediatrician in our area, did things, maybe sit a little bit differently with you because you understand, the anatomy and a lot of science behind it?
It's a little bit of a double-edged sword because I do know a lot, and so I ask lots of questions.
That's good.
And so that sometimes makes you a difficult patient as a physician, I think. But you also kind of know too much about stuff, and obviously breast health is not my specialty.
Sure.
So I kind of know enough to just really worry myself sometimes about things, what if this, what if that. I certainly am a good advocator for myself and for my own health, and just as I advocate for the children that I care for, I've learned to do that and to ask the questions so that I can make the right decisions about where my path is going to go.
Also, given the fact that you were a doctor, was it easier to not convince, but to have an open and honest conversation with your doctor to say, listen, this is in my family. I feel it necessary to take these measurements and these precautions and go ahead and have this elective surgery. Was that an easier conversation to have as opposed to somebody who's out there listening who might feel a little nervous to have that?
I think it may have been. And my team of doctors, I ended up with 4 physicians that cared for me during this time, were very good at listening to my concerns and understanding that I wanted to be very proactive, that I have a lot of things left to do and children to raise, and did not, with cancer basically staring me in the face, didn't want to wait for it to come and get me. Sure. I just wanted to head it off at the pass and be done with it and move forward. So I do think they may have listened to me maybe with more credibility, but I know they listen to all their patients too.
Absolutely.
And part of it is because I know what questions to ask and where to push, or someone who might not have my background might not know how to do that as well.
Having said that, what would you tell folks also listening and watching this about what questions to ask? What's important?
Things about what your risk actually looks like. And prior to my surgery, my risk of developing breast cancer was somewhere around 70 to 80%. My risk after surgery is not 0, but it's about 3%, and I can live with 3%. I probably have a higher risk of being in a bad automobile accident or something than dying of breast cancer at this point. So understanding the risk-benefit ratio of every decision that you're going to make going forward, and as a scientist, I like to look at the numbers. What are my chances of this or that as I go through this treatment or that treatment, and then talking to lots of people who've gone through it. And that was probably the most valuable thing for me, even as a physician, is with the incidence being about 1 in 8 women, we all know somebody who's had breast cancer, or at
Sure.
least knows someone who had breast cancer. And once you get a diagnosis like that, people seem to sort of come out of the woodwork to talk to you about it.
Yeah.
And I can't tell you how many times I was dragged into a bathroom to see the cosmetic results of someone's surgery, which was wonderful.
Yeah, you want to share that.
Because it allays a lot of the fear about, okay, what am I going to look like?
Sure.
There are multiple different procedures you can choose from, and if you can find people who've had different ones, then that's helpful.
Yeah.
I was fortunate in that I didn't have to go through chemo and radiation, so I didn't have to worry about that part of
Experience
it.
that, sure.
But I've tried to pass that on too. I have a friend who's currently or just had mastectomy a couple of weeks ago, and you know, tried to go over and sit with her and do the same thing that my friends had done to me.
Yeah. Well, Dr. Michelle Fiscus, we so appreciate your time. Thank you for coming on and explaining everything in good detail and giving such great advice as well.
Thanks very much.
This year is going to be a healthier and happier one for you.
That's right.
All right. Thanks so much.
Thank you.